Hello, everyone. Welcome to the Dr. Sophia ObGyn podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn podcast. We are so thrilled, especially in this week of Black Maternal Health Week, that we get to have as a special guest, Mr. Borough President of Brooklyn himself,
in the house,
Antonio Reynoso.
Yes. Thank you guys so much for having me.
We are so excited to have you. I just want to give a little shout out to you and give a little bit of a blurb of exactly who you are. First of all, being the youngest borough president elected, the first Latino borough president elected. And before this, you were a staunch advocate, even before you got into the borough presidency, for Black maternal health. So is there anything you would like to just make sure that I didn't miss in that little blurb about you?
I'm really excited about this, to talk to both of you. But my upbringing and where I came from, my parents were both immigrants from the Dominican Republic that came to this country with welfare, food stamps, Section 8, WIC. I was born in Cumberland Hospital. So just government really showed up for me when I was a young person. And I think those opportunities helped me get to where I am today, and it really drives who I am. But I like to start off by letting people know where I came from, and why these things are so important to me. So, but you got it. I am one of many firsts, and I'm deeply proud of that.
Well, we are so insanely excited to have you here on our program. And I think I'm just going to start with a couple of stats. It's super important for people to understand the gravity of this problem, or why we even talk about Black maternal health. Black women in the United States are dying at a rate of 3 to 4 times that of their white counterparts. And when we talk about New York City, we're talking about up to 8 times. And if we go into very specific ethnic groups, such as those that I relate to, being right across the aisle there from you, I'm a neighbor as a Haitian American, that can be as high as 12 times. So why don't you tell us a little bit more on how Black maternal health just became a real dominant issue for you, and how it became really personal to you?
So my wife was pregnant, about to have our first child, Alejandro. And we were looking for where to have what facility, what hospital would be best for her to experience the sacred birth. And we went to a private hospital in Manhattan. There were no midwives. We had 15-minute meetings, and we were kicked out of the hospital. And it just felt so. It didn't seem like they were hosting the process of having children or having a baby in a sacred way. And my wife didn't feel comfortable. So we went to Woodhull Hospital, and in Woodhull Hospital, we met Helena Grant, who was the midwife, our midwife that we didn't know was the great Helena Grant. So we just happened to be very fortunate to have her with us.
So that hospital is in Brooklyn, just so.
Yeah, so Woodhull Hospital is one of the 3 public hospitals in Brooklyn. And they have, or had, one of the more exemplary, extraordinary midwifery programs in the entire state in Woodhull Hospital. And I knew that maternal health, Black maternal health specifically, was a problem, but I didn't know the gravity of it all. And it wasn't until I met Miss Helena Grant that she communicated to me that my wife was 8 times more likely to die during childbirth than her white counterparts. And I said, how is that? And what can I do to be helpful? And she said, your baby's going to be born in 6 months. There's nothing you can do at this moment to improve her outcomes. There's so much institutional and so many historical issues that make it so that we won't be able to see progress in a way that could affect, your wife's experience in a positive way. And I told her, if I ever got the opportunity to do something, regardless power, influence, or money, that I was going to change the way we thought about Black maternal health here in Brooklyn. And I got elected to borough president shortly after that. And I had to follow through on the commitment and the promise I made. But it all started with my wife as a Black man, as an Afro-Caribbean man, Afro-Caribbean woman. It was a sad thing to hear that there was very little we can do in the greatest city in the world to save my wife or improve those outcomes for my wife.
Wow. And what you say is absolutely correct. That concept or that feeling of just feeling like powerless in a situation that seems to just be so pervasive throughout the system, throughout this, not only this city, but throughout this country. What do you think was different in your experience she's obviously, you had a great experience with a safe delivery, let's just put it that way. So what was the thing?
So I think there were two things that Miss Elena Grant, and then, that she did. And also Odessa Finn was our second midwife for our baby Andres. They both did two important things. C-sections were off the table, and it was only of last resort should we need a C-section in an emergency case. In many hospitals, C-sections are an easy way out. They move through it very quickly. They don't wait long. They don't wait enough time to see if there are alternatives, and especially if they're Black women, they're just going right into cutting them open. And because of the historical health complications, the inability to coagulate, high blood pressure issues, so many issues, that makes it so that there's a higher risk of death when you do unnecessary C-sections. And there was just a plan for the C-section conversation. If we need to get there, we will get there, but we're going to do everything we can to prevent that from happening. And the plan was there. So I felt good about that my wife would only have to go through that if it was medically necessary, not because it was medically easier. And the second thing that she did was my wife had a voice. There was one time for our second baby, they tried to take him out of the room to go weigh him. And Odessa Finn was in the room and asked the nurse, "Why are you taking the baby out of the room? Our policy is to keep the baby with the parents or the mother at all times." He's like, "Oh, I'm just going to go weigh him." It's like, "No, you bring the scale to this room and you weigh him here." And that advocacy that she did, my wife and I were uncomfortable, but we don't want to say anything because it's a nurse, it's a person in a white jacket, and there's like a power dynamic there. And the midwives in Woodhull always made sure that the power dynamic was with the patient, always with the mother. And those two things are things I don't necessarily know we would have gotten somewhere else. So it was just a plan to only do what was necessary on a C-section front, and also giving my wife an opportunity to be her greatest advocate. And should we ever feel uncomfortable to not be able to speak up, that they would speak up for us. And that experience, I think, again, made it sacred, but also made it so that my wife felt heard, which is commonly the number one thing that Black and brown women don't feel when they're in these situations or having a baby.
So one thing I wanted to ask is, you talked a lot in terms of the experience you had with the midwife. And I think we don't talk a lot about midwife in general. So how would you describe midwife, and what was her role actually in terms of the pregnancy?
So we had an OB, we had a midwife. We saw the OB twice, but the OB was not in the birthing room when we had the baby.
Gotcha.
And the two times we saw them, it was maybe 15 minutes, maybe. They were not there a long time. The midwife was our entire process. 90% of it was with the midwife. And we didn't exactly know what to expect from midwives. We didn't know what to expect of the entire experience. We just went in there knowing in the statistics and the work that we've watched that midwives help save lives. So we thought we needed one.
That's fantastic. I do think that you're making a very valid point. I mean, when we look at birth across the world, oftentimes it's attended by midwives with, very, very good outcomes. And I think that you having made that kind of a choice was a great way, definitely in terms of mitigating a lot of risk. But I know that you've done a lot in terms of initiatives since you became borough president, especially having donated basically and made a financial commitment in a very big way to Black maternal health. Can you just speak a little bit more to that?
This is where I like to talk about scale and how important it is to go all the way. So the commitment I made while I was running for office the first time for borough president, I said that I will spend all of my money in my first year on Black Maternal Health, and that's it. Like, I would do that. I got $45 million from the city of New York to be able to allocate to capital costs. And I ended up giving 3 public hospitals about $15 million each. And they were going to have state-of-the-art birthing centers because of it. And I'm not talking about the other places, they've given $1 million or $2 million and made a difference. We're talking about complete gut renovations and having, with hot tubs, meditation rooms, these showers that hit you from all sides so you can get massages, like really doing something that is an experience that would be unusual in a public hospital, that a woman on Medicaid would traditionally not feel that she would have access to. But not here in Brooklyn. If you go to a public hospital, you will have facilities that you don't see anywhere else in all of the city of New York, and I would challenge in all of the world. And so I wanted to make sure I could give that experience to people because I wanted infrastructure to not be the excuse. We got a lot of work to do, and a lot of deaths happen for other reasons, but infrastructure should never be the reason.
That's amazing. I mean, I fully agree with you that, all women, regardless of how they're able to pay for their medical services and their healthcare, should feel that they are getting equal experience. However, we know that Black and Brown mothers do not have that experience. And so just to start with a facility, at least when they walk in, they feel like people care about them just based on the way that the facility looks, automatically starts to elevate the level of care that we expect. What other investments or what other areas or issues do you feel would also start to move the needle?
So we did 2 other things we did the second year, and it's baby boxes. So what we did, now everyone's talking about them, but we started that. We were the first borough that gave out baby boxes. And we did that because what we don't want is the mother to ever have to choose between diapers, to worry about the stress of baby wipes, bottles, and whatever it is that we need to give these kids, a pump to encourage breastfeeding. We gave a lot of things in this, and our main goal was the mother needs to be in a place of zen and joy after this experience. Eliminate all the negativity or any obstacles that they could have the first month. And this baby box wasn't going to do it all, but it was going to contribute to that. The next thing we did is we threw baby showers, community baby showers. So there are a lot of parents, like you come from North Carolina, you come from Florida, you move here, there's no auntie, there's no grandma, there's just like, you don't have a family support system necessarily. So what we want to do is be the village. So what we're going to do is we're going to throw a baby shower, which we threw in Brownsville, and had 100 pregnant women show up and gave them it was a baby shower. They had a big chair with balloons. They took pictures. We had music. We had food. The kids were running. Other kids were running around. And it was like a real family atmosphere. And it's like, you know what? You might not have immediate family here, but you have your Brooklyn family. And we love you. And we want you to do well. We want to show you matter. And that also helped. The other thing we did was marketing, like educating people on birthing and understanding what it means. And we take it for granted that, yes, it is an act that has happened since the beginning of human life, but the educating of people is not there. They're not informed exactly what rights they have, where they should be going, how many times they should get checked up, all these things. And we did that in English, Spanish, and Haitian Creole. We also put it up on bus shelters, in subway stations. If we are here targeting the people that are most vulnerable, we have to do it in Haitian Creole. These areas in Brooklyn that have more Caribbean women, but specifically Haitian women. So we were thoughtful about all those things. And then this year, we have our first perinatal mental health accreditation program under Brooklyn College. So right now, if you're a therapist, if you're a doctor, if you're a psychiatrist, if you're a daycare center worker, whatever it is that you do and you're around pregnant women, you can go to Brooklyn College and get credits and a certification specifically to address maternal postpartum depression and maternal postpartum anxiety, and do that in a specific way. Because right now, a therapist can help you with depression, but do they understand what it means to be depressed because of after a birthing process? And we don't know that. This one is going to be specifically tailored to do just that. So it's going to be the first program of its kind in the entire state where you can be a therapist and then have a certificate through Brooklyn College that specifically says that you're a specialist in treating postpartum mental health issues. So that's something else we did because we knew that I had to be a part of it. So I didn't just give money. I'm really trying to change the game here in Brooklyn. And I hope that in 4 or 5 years, this is going to be the safest place in all of the city to have a baby when we're done. That's the goal.
Well, you're really on track on doing that. It's amazing all the different initiatives you're doing. And I think you're trying to look at this in a more holistic way, right? And looking at the whole person in terms of what they're actually what is their lived experience and how to support that in different ways. All of this that you invested in, that you put so much energy and your mission behind this is obviously because of the ridiculous, atrocious stat that we said at the beginning, which is 8 times more Black women will die versus white women. And the first time that Sophia actually told me this, I was just like, wait, can you say that again? And then she said it again. And because I'm a rational person, I said to myself, well, is it because there's something physiologically different? Like, is there a greater tendency for Black women? Do they have certain sensibilities that white women don't have? And Sophia obviously said,
No, absolutely not. 100% no way. So we
so
are
then
all.
I said, then because the question becomes, okay, then why? And I know we say institutionalized racism, but I think it's important to actually understand what does that actually mean in the health space and how a Black woman is actually treated.
So I'm just going to say 2 things. First of all, that absolutely there is no physiologic difference between a Black woman and a white woman. Okay. We may have different lived experiences, that is true. We may come from many different backgrounds, that is true. But when it comes to Black maternal health, one of the things that people really need to understand is that that happens to women, Black women across the board. We're not only talking about poor women, and I know, Antonio, you say this all the time. We're not talking about only Black women who are poor or who we think are completely underserved, etc. We're talking about all Black women have this potential statistic. And they could be CEOs of companies. They can have master's degrees, doctorate degrees, and other professional degrees. They can have education that is far beyond the people who are actually taking care of them and still have this exact same statistic, which is why, it was so important for you to find how can I mitigate this risk, right?
Yes. And I would say this. So I always go back to like Serena Williams is arguably the closest thing to a superhero that exists on this earth, right? Physically, is as close to like a perfect physical specimen that you can ever see in your life. She is extraordinary by every measure. And she is rich beyond means, has unlimited pots of money. So whatever experience she's going to have during childbirth, you're talking about physically, she's in the top 1%. In the money wise, she's spending money in a hospital or with a doctor in the top 1%. Everything goes right. And she still almost lost her life during her birthing process. It was a difficult one. She needed blood transfusions. All these things happened. And we say like in infrastructure and like the racism, institutional racism, but I don't think a lot of people understand it. And I'll give one example, like institutional racism that is real, is that Black doctors, right? Black doctors, while OBs tend to be, OBs are doctors, right? The amount of OBs that exist that are women of color or are people of color is so small. It's so small compared to the demographics of the people having babies in New York. It's not even close, right? So until we don't start building a system by which we can encourage more Black kids to want to be doctors and have those kids enter a system that is fair for them, that is culturally respectful of their, like where they come from. And then from there, getting them into these hospitals, we got to wait like 20 years if we do it perfect. So we got a long way to go. What I'm doing, I really feel is the best I can do under the circumstances I have to try to put a Band-Aid on a gaping wound. What we really need to do is start from cradle in the beginning and start building a system that can help Black women.
I fully 100% agree with you that the major way in which we are able to start to really make some leverage in terms of change is with the education process, and it's on all fronts. It's educating the patients so that they understand their birthing rights and the birthing process, number one. It's educating the actual doctors. But before we get to the doctors, it's, as you say, inspiring and motivating Black children to go to institutions where they will be allowed to shine,
Yeah,
basically,
absolutely.
in order to become, motivated to become physicians, to become midwives, to understand their role in the healthcare space.
And Dr. Sophia, can I ask,
Yes,
because I want to make it a conversation. I want to ask you some questions too, and just like go back and forth.
of course. Please do.
There is a tension right now in our Brooklyn hospital system between midwives and OBs, and like who should be in charge or who's. And the one person I just want to say, I'm not going to name who they are, but they said, Antonio, midwives can do 95% of births. Great. It's a perfect, and they're going to do a great job, and you don't ever need to see a doctor. But in that 5%, you're gonna pray with all your might that there's an OB by, there's a surgeon, like you need all these things. And we want to be prepared for that. And that's why the OBs are important. But now a coexistence here is hard to do. It's like art, not science. A midwife might say, Dr. Sophia, she might say, a midwife might say, we could wait another hour before we have to do a C-section. But an OB would say, I think the C-section needs to happen now. And like, how do you get to a place where there's some synergies that make it so that there's not a conflict between midwives and OBs?
So actually, it's one of the things that I like to say all the time is the fact that in the healthcare community, the concept of what is the role of the OBGYN, the role of the midwife, the role of the doula, there are three completely separate yet synergistically can bring about the best outcomes when it comes to patients, and especially when we're talking about Black mothers. Where we need help is exactly that, in the education, in order to take away this concept of the hierarchy, when what we really need to be is completely patient-centered.
Yes,
Okay.
agreed.
And so if we were really patient-centered and we understood why we need those three different providers, and we're not leaving out our nurses, we're talking about everybody who is going to be at the touch point of the patient. Okay. But it's the understanding that everybody has an equal voice when it comes to advocating for the patient. That's number one. Number two, improving the relationship, as you say, between OBs and midwives comes from an educational process that's not existent. Okay, I'll be the first to tell you that in my training, when a patient came in, although I was trained at a hospital that did have midwives, and I'm very grateful for that, because of the fact that I was able to watch the midwives with their patients and utilize a lot of their methods in terms of the approach to the patients. And so I think it's in the education that if the doctors are not able to actually see the role of the midwife, because instead it seems as if there's constantly an adversarial relationship, that because the midwife is quote unquote advocating for the patient, she's therefore against the doctor. And we both have to come to a point where we understand what the actual complications are, what is the waiting time, and it's a matter of understanding who is in front of you.
And also we have to keep the ego on the side.
And there should be no ego in
Yeah.
this. There really should be there should be no ego in this. However, just in doctors, for example, going through the residency programs, there's a hierarchy. Okay. And so I think what we need to do is start to deconstruct the way we really do the medical education. And that goes across the board. Now, that again is a very lofty goal, but I definitely think we need to start somewhere. And I think including midwives as part of residency training is one. Two, as far as medical students and nursing students, including coursework that has to do with institutionalized racism. How do we treat patients? How to actually have simulation, basically, of different scenarios and situations, and see how patients, how our providers respond to that, okay, across the board, is the way that we're going to be able to check our own biases. But yeah, how do we start that? Where do we start that? Is the question.
My next goal is going to be to figure out a way to bring us together, because you said something that was so important. There should be no egos, and this should be about the patient. and their experience. And we're not there yet. And I want to get to that place because that is a struggle. Those politics I'm struggling with in our hospitals here in Brooklyn.
Yeah, there's no question about that. So, you know, that's definitely something that we can all look forward to, is the concept of how we bring the healthcare providers together so that they're always staying patient-centered. But what are the areas that actually give you hope in this fight for Black maternal health and the concept of advancing the education?
Can I go back before we go into the hope part? Because I still want to drill down on one thing and then we'll come back to
Okay,
the hope.
of course.
I still want to go back to what we talked about in terms of the 8% because we still haven't
8 times?
deconstructed it.
Eight
So-
times, yeah.
Yeah. So what does that, 8 times. So why does it happen? Like in terms of the day to day, what is the relationship of physician to patient of a Black mom or mom to be that incurs this type of prevalence? What would you say?
What I try to do, especially with Black men, is just like have a very simple message to try to really get across people like what it is. If you're taken seriously in a hospital and you're a Black woman and you go in there, you might have diabetes, you might have hypertension, you might have a whole bunch of things. A good hospital will find that out long before you're in the birthing process. And they will build out a plan of action for you throughout your entire pregnancy. In private hospitals for white women, this happens all the time. They know exactly what the white woman's needs are long before they're having their baby. And they've done work prior to the pregnancy, and they're prepared during the pregnancy to address whatever those issues are for them. For Black women, they don't do that. And not only do they not do that, when Black women express themselves that there are issues that they need to be addressed, they go ignored. They also, studies have found that pain threshold, that is an assumption that Black women can stand pain longer than white women. So when they're saying that they're in pain, that they don't back off, that the doctor keeps going or keeps doing something, and then in doing so harms the patient even more. And a white woman wouldn't have to go through that because the biases that exist with like the strong Black woman. So her pain that she's saying she can hold on longer. So little things like that, a plan of action early in the process to prepare for whatever outcomes might happen can save a ton of lives. But they don't. They're cycling these women through like with very little respect for the process, with very little respect for them. It just happens to be in our city that most Black and brown women are poor, right? So we're talking about hospitals that are just churning these folks out. They're not getting paid a ton of money through Medicaid for these services. They have substandard infrastructure. All these things are happening. And then after that, with mental health, with prescription drugs, and like not educating them properly on exactly what they should be doing. When they're in pain after a process, they could have internal bleeding and they're sent back home because they're not properly checked, because they don't believe what they're saying. They don't believe Black women when they say they're in pain. All those things add up.
And then more critical situation can arise because of that.
That's exactly what
It
happens.
sounds absolutely insane when you hear it, that one group of people has a certain type of experience and others don't. But it's just ultimately it just comes down to listening to Black women. And I think a big part of it, and that doesn't happen right now.
Listening and believing them.
Yeah.
I think that part is just so important to this conversation, because if we want to look at it from a holistic perspective, that is such a big piece of the pie. That's probably one of the hardest things to address because it's really about perception and institutionalized and systemic. But we still have to talk about it to understand the whole issue at large.
But also with like dealing with biases. One thing is teaching a bunch of white doctors not to do that, not to have those biases. Another thing is having enough Black doctors where those biases don't exist, but we don't have them. So now we expend a ton of resources and money to educate a whole like generation of mostly white doctors to learn how to treat Black women, versus expending all those resources to just simply get more Black doctors in the room and have more of a diversity in the doctors pool. For you, Dr. Sophia, like I want to be honest, it is such a rare thing to have a Black woman doctor. It's so rare that when people see it, they can't believe it. And it shouldn't be the case.
It's so true. You're 100% correct. It's funny because, of course, for me, all of my friends are Black women, right? They're Black women
Yeah.
physicians. So to me, I'm
Yeah.
like, what do you mean?
Oh,
But
there's a
no,
ton of us. Yeah.
there's a ton of us. But no, the reality is
Yeah.
there really isn't a ton of us. If
Yeah.
anything, there's an incredibly small number. And then we're talking about all physicians. So now let's go do a deeper dive and say in terms of Black OBGYNs. That number is even smaller if we think about it from that perspective. And yeah, you're 100% correct. At least even if we started with having more Black physicians in the room, they can at least identify more culturally with the person that's in front of them and therefore apply a much more sensitive lens when it comes to the treatment of those patients.
One thing I wanted to ask, which I think was really good that you talked about, which is that you are a male voice and you're very proud of being a male voice in this
Yeah.
space, because usually women will take on this topic. Can you talk a little bit about that?
We need to make sure that we have voices, mostly Black men, to stand up for the women, Black women, and these issues. And also to understand that this is not a woman's issue alone. This is a societal issue. And healthy birth outcomes lead to healthier long-term human outcomes. And I didn't know it was going to matter that much. I always felt a little out of place. I'm not a Black woman, but I'm here talking about this issue. But when I started doing it, the support I got from Black women and saying, thank you so much, that it's not only us screaming at the top of our lungs to listen to us, that there are other people that heard us and that are a part of the team and are allies in this work has been extraordinary. And I couldn't tell you how proud I am of this work to do this. And remember, I'm part of a team. I don't move without calling them. I don't move without talking to them. And we might disagree on certain things, but they know that I'm centered around my task force, which is led by all Black women. And I say I'm a megaphone, a boombox for their advocacy. And Ms. Grant always tells me she disagrees wholeheartedly. She's like, you're more than that. And thank you for taking it. I'm getting emotional just thinking about it, but more of us, we need more men to be a part of this fight and not make this solely a Black women issue. This should be a human issue that we all take on. And I'm focused on taking care of Black women, but everybody reaps the benefits of that work. And nobody's going to say, hey, Antonio built this, only Black women can have babies in these hospitals. That's not what's going to happen. All these things that you're seeing that are coming to fruition are all because I've centered Black women, but are going to help all women. You're right. You're 100% right, Dr. Sophia.
Yeah. And so I think you've really eloquently expressed why this is an important issue. And moreover, how Brooklyn is really standing in the forefront of making those changes that we're, as a whole, we hope to make. Give us some of your lasting words or what else would you like us to, what else would you like to see in your borough, okay, and at large?
This is the most women that we've had in the city council, at the state level, and so forth. And it just still doesn't feel like it's enough. Like it's like people don't know what big means. We have small, narrow-minded people. Instead of having dreamers, be a dreamer. You can shut things down and rebuild them to do what you wanted to do. And I just want people to have bigger ideas, bigger dreams. Do something that is completely outrageous, because this is an outrageous issue that needs an outrageous response, right? Like you got to meet the crisis moment with a crisis level reaction. And we don't do that right now. So that's what I want to inspire. I'm hoping I'm inspiring a new generation of young electeds to want to get more involved. And then the last thing is the Black doctor movement is big. There was a time when everybody wanted to be a doctor and a lawyer and this, and it's just like we stopped telling our kids they could be that. And what we should be doing is like significant scholarships to help young Black kids achieve their dreams in a way that it doesn't make it physically impossible.
I would also say, all these amazing initiatives that you're doing that are helping Black mothers and just mothers at large, just the fact that you have a voice and talking about this is already huge, because now people have to look at where the money is spent. where usually this is not a point of focus, right,
Yeah,
from
that's
leaders.
true. Yeah.
And so now people have to say, oh, Black maternal health, why are we focusing on this again? Like, what's going on? So just that level of initiative is opening up more culturally this type of conversation where we didn't have before. So kudos to you to do that.
Thank you. I want to talk about maternal health so much that I want people to roll their eyes every time I bring it up. Like, I want them to be like, Antonio's talking about this again. I want to be
Yes.
so annoying to them. It's like, again, every state of the borough, I have a new initiative. It's like, okay, he did maternal health last year, so he's not going to talk about it this year. It's like, no, I got more to do on maternal
All
health.
right,
Let
I'm
me
gonna
show
give you
you.
10 more bullet
Yeah,
points on
exactly.
this.
And you know what? Until we don't break that inequity down to zero, I can't stop. And, I just hope that I'm able to continue to be in this work longer so that I can get to really eradicating any inequities in this borough. And I feel like we're gonna get there.
Wow, Antonio Reynoso, Brooklyn Borough President, I cannot thank you enough for joining us here on the Dr. Sophia ObGyn podcast. Your energy and your light, the torch that you are carrying for this movement, for this incredible big issue, is really palpable. And I thank you from the bottom of my heart as a Black OBGYN, as a Black mother, as a woman who went through the system, who had 2 kids and experienced the whole thing. If I only wish I had a Antonio Reynoso at that time.
Thank you guys. Thank you guys for continuing this work, and that I'm honored to just be a guest, to be a part of this process, part of this movement. It's been a joy and an honor of my life, and definitely of my tenure here as borough president. And I'll be here with you guys doing this work, and call on me whenever you need me. And hopefully, when I'm done, if I get the pleasure of continuing to be the borough president, but when I'm done in 5 years, we're going to see statistics in Brooklyn that is going to blow everyone's mind. And once we have the model, I hope every single borough does it, and then New York City really becomes the model of all of this nation on how to protect Black women and all women during childbirth.
Amen to
Amazing.
that.
Thank
Amen
you so
to
much.
that.
Thank you
Yes.
so much,
Thank you.
Antonio.
Thank
This
you,
is
guys.
awesome.
Thank you. Thank you so much to our listeners, our community at large, for joining us on today's podcast. Bye, everyone.
Bye.
This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.